The skin is your body's largest organ. It's an important one too, since it protects you from germs and other things that can make you sick. But like other organs in your body, your skin can develop cancer, and the most serious form of skin cancer is called melanoma. Doctors have known about melanoma since at least the 5th century BC, when Hippocrates, the father of modern medicine, mentioned it in his writings. The first successful surgery for melanoma happened in 1787, when a Scottish doctor named John Hunter, one of the most esteemed surgeons of his day, removed a tumor from a man's jaw. Melanoma begins in cells deep in the skin, called melanocytes. Normally, these cells produce pigment that gives skin its color, but damage to the DNA of melanocytes can cause them to grow out of control and form tumors. There are other forms of skin cancer, but melanoma is by far the most dangerous. That's because it's much more likely to spread to other parts of the body, which is called metastasis. That makes melanoma harder to treat. The most common cause of melanoma is exposure to ultraviolet radiation, or UV rays for short. Sunlight is the main source of UV rays. Others include tanning beds or tanning booths, and sun lamps used for tanning. Melanoma may be less common than other skin cancers, but it will be diagnosed in nearly 100,000 Americans this year, and close to 8,000 will die of the disease, according to the American Cancer Society. Over 1.3 million people in the United States are living with melanoma. Anyone can get melanoma, but some people have a greater risk. That's true if you spend a lot of time outdoors, especially if you live somewhere that's sunny most of the time, or you have had frequent sunburns. Melanoma is more common in older men and women, though young people can get it too. White people are about 20 times more likely than black people to be diagnosed with this skin cancer. And if you have a lot of moles on your skin, or a close family member who had melanoma, that increases your risk too. The most common symptom of melanoma is a spot on the skin that looks like a mole. A mole is a harmless dark spot, and just about everybody has at least a few, but you should be suspicious if a skin spot has certain features. For example, a mole could really be melanoma if it's wider than a quarter inch or has recently changed shape or color. Other possible signs are a skin spot that's an uneven shape, has a jagged border, or has a raised surface, especially if it bleeds. Skin spots like these could be melanoma, so get them checked out by a doctor. You can reduce your risk for melanoma and other types of skin cancer with some simple steps. For starters, avoid the sun during the middle of the day, when UV rays are strongest. When you do go outside, cover up. Wearing long sleeves, pants, or skirts, as well as a broad-brimmed hat, can protect exposed skin. So can sunscreen, which you should apply to exposed skin before you go outdoors. Read the label when you buy sunscreen, and look for products with a sun protection factor, or SPF, of 15 or higher. Use plenty of sunscreen and reapply it if you're outdoors longer than 2 hours, or if you swim or perspire heavily. When melanoma is detected early, it can usually be treated successfully by a surgeon. If melanoma has advanced and spread to other parts of the body, medications are given to kill the cancer cells. In the past, most patients with melanoma that has spread received chemotherapy, but thanks to research and clinical trials, new options are available today that give melanoma patients a better outlook. One new option is a type of drug known as a targeted therapy. These medicines can kill cancer cells that are growing and spreading fast due to specific gene mutations. Another new approach to treating melanoma is called immunotherapy. These drugs make the body's natural defense system stronger and better able to shrink tumors. Targeted therapy and immunotherapy have improved melanoma treatment and the lives of patients. However, there's another option for many people with advanced melanoma. Enrolling in a clinical trial can give you access to new therapies months and even years before they're available to other patients. These advanced treatments can be life-changing, and some may even offer a cure. There are currently more than 600 clinical trials of melanoma treatments underway or getting started around the world. Give yourself the gift of hope by learning about all of your melanoma treatment options.